Hi, welcome to this Bustmob live event tonight, Tuesday, May 15th. My name is Gianna, and I am fortunate enough to be moderating this event. Thank you all so much for being here with us tonight at Move with Confidence. We're really excited to be hosting this. This is actually the first time that we've had one of these events outside of Bustmob, sort of in this open access forum. So if you're not familiar with Bustmob, Bustmob is a community of over 100,000 women empowering other women. And our mission is to serve women who are in the research phase, considering actually having and healing from, or who have had plastic surgery. So if you're not part of our community, we would love for you to join us on Facebook. The name of the group is Bustmob. And tonight we are joined by two really incredible women, Danny Antonellos and Brienne Koff, who I'd love to introduce you to before we begin. So Danny is an osteopath. She is also the co-founder of United Health Education, co-founder of My Training Space app, and she is also the co-owner of her gym in Sydney, Australia, Pato Performance. She is the co-host of the Level Up podcast and is also an FMG Bikini Pro athlete. So welcome, Danny. Also joining us tonight is Brienne Koff. She is the owner of Mental Sweat. She's a certified health and nutrition coach, a certified personal trainer, rehab and movement specialist, United Health Education, certified pre and postnatal exercise and nutrition coach, massage practitioner, and PNBA Bikini Pro athlete. So in addition to their brilliance and their work with women, both Danny and Brienne have had breast surgery themselves. So they really have a unique point of view to this topic. And we're really fortunate to have both of you with us tonight. So thank you for joining us.
Thanks for having us. Very excited.
Yeah, welcome. So before we get started, I just wanted to sort of talk about why this is a topic that's really important to us. And inside the Bustmob community, everything that falls under this umbrella is a really common topic, and it's something that we have recognized that there's just not enough high quality information, and that the information is not necessarily coming from the professionals who are qualified to speak on it. So it can be dogma, it can be rumors, it can be things that sort of get perpetuated online, or it can just really be fear that sort of exists in a vacuum, and it tends to be around messing something up or harming your results or compromising your results in the short term or long term. And we know that it's really important for women to lift weights and to be moving and to have good, lean mass on their bodies. And we do not want breast surgery to be something that stops women from pursuing their fitness journey. We feel like it is our responsibility as this really large community to make sure that we're really good stewards of the information available. And we want to make sure that we're putting that out there and making it available. So we know that the more you know, the better you feel, the more empowered you feel. So we want to always be connecting you with experts on these topics and bringing you the best information we possibly can. So I think without further ado, we will begin. And we're going to start with Danny. Sort of share some of your experience with us if you can, and why you feel like training is so important.
Thank you. And I love that we all align on these very important values. And yeah, it's great to be here talking about this for the first time within your community. So I've coached hundreds of women, and a lot of them have had breast augmentation procedures. So whether it was in the fitness industry as a bikini competitor, it's so prevalent in that industry, but then also, general population as well. And I've gone through it myself. So there are extreme benefits of both pre and post-op training. The fear around training, yes, as you mentioned, there is a little bit of misinformation around damaging the implant, or, people think, oh, I've had my breasts done, I don't need to train chest anymore because I don't need to grow in that area. But training your chest and training around surgery isn't just for aesthetics. It is about how we function as a living human, reaching and grabbing, lifting our kids, playing sport, overall health and wellness, we need a strong upper back. We need to be strong through our upper limbs as well. So posture, if we do neglect those areas, yeah, it's not just about growing the pec muscle, it's about how are we functioning for the rest of our lives, because we're here to be strong, we're here to be healthy for as long as we can, and training is such a large part of that. So if we do omit, training upper body or training chest from our lives, then we can run into further problems down the track. We can lead to other injuries. I see it all the time. People neglect training their chest, and then they develop poor posture, so more of a slouch, internally rotated shoulders. That can lead to tight upper traps. It can lead to neck pain, headaches, even down into our lower back, because if we're sort of hunched over through the upper body, then everything's connected, right? So it leads to our lower back as well. So yeah, it's not as simple as, okay, you've had the surgery, now let's just stop training the chest. Well, no, we do need that to function well as a human, and it is very safe to train your upper body, to train your chest post-surgery, if done well with the right guidance. And that's why we're here today, to allow you to not feel scared to train, to really understand the benefits and know that it is safe, and it doesn't have to be as hard as what you might think.
Amazing. Thank you for that. Do you think you can talk to us a little bit about post-operatively, when it is time to sort of return to movement and we are trying to move to our baseline? Things feel different post-operatively. And I think because we don't know what to expect or we don't know what's happening, we think something must be wrong. Can you talk about sort of this return to movement, and then also what's going on with the chest muscles and all of the associated muscles post-operatively?
Yes, absolutely. So, and I remember this feeling all too well post-op, and because I got mine under the muscle. And we'll talk about the differences later on, but mine were under the muscle, and you wake up and you've got the compressive bandage, and it feels like there's just such a heaviness on your chest. And I was younger, I remember describing it. It feels like there's an elephant sitting on my chest. That's my experience. Everyone's experience is different. And then, yeah, naturally, our body sort of moves forward. The shoulders move forward, the chest muscles become shortened, the upper back muscles become lengthened. I remember also experiencing, just some pain in the upper back after being so guarded going forward. But that's just the body's beautiful way of trying to protect an area that has had something happen to it. We've had incisions, we've had a surgery. So the body goes into its beautiful protective mode. So the first 2 weeks, we kind of honor that mode. I mean, we need to focus on the rest and recovery, because that's our priority. Rest, recovery, and listening to the surgeon's post-op advice, of course. And then gradually, or after that first 2 weeks, then we can start to explore, just some gentle mobility work, opening up the shoulders, bringing our shoulders back. And it is going to feel a little bit different, as you mentioned. So it can feel like there's a bit of resistance in the tissue, or a bit of a stretch. But that's because we've spent kind of the first 2 weeks I use these numbers figuratively, so roughly 2 weeks, we want to sort of stay as is. But we can implement some gentle movement of our shoulders, and those stretching feelings, although it might feel a bit scary, or oops, what's going on, that is a very normal part of what lengthening a shortened muscle should feel like. So it shouldn't feel sharp. You'll notice the difference between a light stretching sensation versus, ouch, that really hurts. So just use your initiative, and as we start to play around with those positions, just stay in tune with your body, but know it's going to feel different post-op to if you were doing those movements beforehand.
Yeah. Thank you for that. I think that's really encouraging. I think this concept of pain being self-limiting is a really good guideline here of, it's okay if it's sore, but you won't be able to continue if it hurts too much. Like our bodies are very good at helping to tell us, especially as we start to move past that initial healing phase where we have some residual numbness. So thank you so much for sharing that. Bree, you have a really, really cool story to share with us about helping somebody post augmentation sort of rehab back. So can you share that with us?
Sure. My most recent client that went through a breast augmentation surgery about 10 months ago or so, I had been working with her for a few years, so I really knew her body and was able to program specific exercises for her. So we had built a foundation of trust and communication, which made this whole process so much smoother. And we continued strength training as usual up to the surgery to help with and to emphasize on mobility and upper back strength to prep her for the surgery, to support her posture and just prepare in general. And then in the post-op, we obviously were instructed by her surgeon's guidelines. So that can look different with every surgeon's guidelines. But what we did with her surgeon is that the first 4 weeks, my main focus for her was to keep her moving safely without elevating her heart rate, which is really important those first few weeks after surgery. And as Danny and I both say, movement is medicine. So we want you to continue to move after surgery. So we included things like daily walks and gentle mobility work, like thoracic extensions and rotations, and what we call the standing shoulder big three to activate the upper back muscles. And you can find all these exercises actually on the United Health Education page, as well as Danny and my Instagram pages. And then for the lower body, we kept exercises on the floor mostly without any upper body involvement. So, like banded glute bridges, clams, exercises like that, and did some core work, which involved some breathing based exercises like connection breath and dead bugs, to maintain core control and without straining the body. And then about 4 to 6 weeks after post-op or after the surgery, when she was cleared for lower body exercises, we reintroduced movement patterns and performed body weight variations like banded box squats, lunges, and included a lot of machine-based exercises like hamstring curls, a leg press, kind of just focusing on getting that movement back into her body and learning those movement patterns again, because those are skill based. So just getting that skill back into your body was really important after surgery, because we have to remember that this is surgery, right? So then after the 6 weeks and she was cleared to return to full body workouts, including chest exercises, we took a very gradual approach, starting with regressions of upper body movements to rebuild strength and perfect the technique first. And then we continued with the upper body mobility and stability work, and it was pretty much a staple throughout her whole recovery. And she still does them to this day because it just helps our overall posture and movement during the day. And then from there, we just slowly progressed the movements and different variations and increased the load and volume, and depending what her body allowed. And so now, 10 months out, she is back to what she was doing before, but it took that long to build it back up safely and effectively. So it's important in this whole journey to have a strong communication with the client, with the trainer, and with the medical team. And so that's how personalized programming can really be beneficial for your journey. So that was kind of our story.
Thank you. I love that. I
Sure.
love the sentiment of the team. It takes a team. There's
It does.
nobody can be the expert in all the things. You have to call the people in. So, and thank you for mentioning the United Health Education app. So, if we have links available, we're dropping them into our chat for everybody. So, if we mention things that are linkable, you can check down there.
Great.
So, The basis of the Bustmob community is that women ask each other questions. I mean, it's a Facebook group. They submit questions in the community, and then we support each other in answering them. We also have experts answering them, like we're doing tonight. So, what I would really like is a lot of our members have submitted really wonderful questions. I would like to sort of volley them over to both of you to get your insight, if that's all right.
Sure.
So, the first
Absolutely.
question, thank you. The first question that we have says, I have under the muscle implants. And I just started working out again. When I work out, it feels weird reaching my arms above my head, and when I pull down, it doesn't hurt, it just feels weird. Is this okay?
Bree, can I ask if your implants were under or over the muscle, if that's okay, just for my
Sure.
own
Mine were
context?
actually over the muscle. I chose to do that
Awesome.
because I was competing. I was about to get into my first competition, and I just decided that was the right path for me, along with my doctor and my coach. So,
Yes,
yeah.
good. We've got the experience on the two
Yep. So
personally,
mine's
over and under. Again, no right or
correct.
wrong. It just depends on, goals and your anatomy and surgeon's recommendations. So maybe I'll take this one for under the muscle.
Great.
But yes, and what I was talking about before, so it can feel a little bit weird and a bit of a stretch if we are moving our arm away from our body. So that's why, as we mentioned and Bree mentioned as well, when we do start getting back into training, we do recommend a nice close grip, whether we are rowing horizontally or a vertical neutral grip pull down, close grip overhead press, and then close grip horizontal press. So that is a really nice way to start because it is not putting too much stretch through the muscle, and then it won't feel as though you are getting that sort of quote unquote weird stretched feeling. And then we gradually need to bring that in. So some of the last movements that will feel comfortable are, of course, for example, a wide grip chest press, whether using a dumbbell or barbell. They're going to feel a little bit off for a lot of people. And then, of course, wide grip pull downs or even body weight pull ups. I find that they're sort of the last ones. And personally, for me, dumbbell flies still just don't feel 100%, and they don't hurt or anything, but it's just one that I took a mental note of and said, you know what, maybe I don't need to do dumbbell chest flies or cable chest flies. It just doesn't feel right for my anatomy. And Brie, I know that that feels okay for you, right? The chest
Absolutely.
flies, we spoke about this earlier.
Yes, I've never had a problem with chest flies or feeling uncomfortable with them. So it depends, and not saying that someone else who had or who has over the muscle as I do would have a problem with it or not have a problem with it. So it also depends on the person. But me personally,
Yeah.
I did not have any issues.
Yeah, so that feeling is quite normal. Sorry, Jana.
No, you're fine. I was just going to really briefly, in case anybody isn't familiar with the differences between over and under the muscle, just very quickly say, I personally, my implants are placed under the muscle. There's two main placements, over and under, of course. The implant can be placed partially underneath the pec muscle, or it can be placed over it. So it would be behind the breast tissue, but over the muscle. So the differences between the two being that when the chest muscle moves, that the implant can move with it a little bit more if it's under. But what I also like to bring up is that we will notice, even if we don't have an implant, that if we engage our pecs, that our breast tissue moves naturally, right? So there is a degree of movement there, and that's normal preoperatively and it's normal postoperatively. But that when there is a device under that muscle and it contracts to do the work, it will move it. For me, it was about the first year. You know, it felt weird, and it would be doing things like wiping a counter. I would feel it engage. But slowly, you know, going back to strength training, that feeling lessened and lessened. And my experience is like you, Danny, where there's just certain things where I feel it more, but there's plenty of exercises that I don't feel it anymore. The next question is, what are good alternatives to bench press or chest flies?
Brie, did you want to take this one?
Well, like Danny had said, is that you can definitely change your grip position on there to make it feel best for you. But if a barbell is too wide for you, then you can change the grip to dumbbell, neutral grip chest press. You can make it the bench inclined, so that could be a little less on your chest muscles. You could do push-ups, and you can have them elevated if it's too much on the floor for you. So there are different just variations that you can do, and you just have to find what's most comfortable for you, and that's going to vary from person to person. So try something out. If that doesn't feel great for you, try a different angle or a different grip, and see if that works better for you. But sometimes, and even maybe with the chest flies, instead of dumbbell chest fly, you can do a standing chest fly if you still want to keep flies in your program. So you just have to find the right combo.
There's
I
always
find that, oh, sorry, John. I find that with movements such as flies, because they are quite pec dominant, it can be a little bit hit and miss whether it feels good or not. However, a staple for every single person should be some kind of horizontal push and pull, whether it is close or wide grip, and then some kind of overhead push and pull down as non-negotiable. So we have to find the variation and even the range of motion that suits you. So a lot of people think that when you're training chest, only your pecs are getting worked. However, to actually train chest properly, and why it's so important, we're talking about it today, it's so important because to train chest, you actually need to have really good shoulder blade control from the back. So you're actually using your beautiful back muscles to stabilize the joint, your shoulder joint, to allow you to train chest. So it's not just about, everything's loose and we're not having any tension in our body and we're just sort of letting our arms do the motion. No, we actually need our shoulder blades down and back, which creates a little bit of an arch through the upper back. And that really stabilizes everything that's going on in our shoulder. So you will feel a nice back workout, and then we can do our presses. So it's not just for power lifters to sort of have a little bit of an arch through the upper back or shoulders down and back. It's actually fundamental for any kind of dumbbell chest press or pressing motion, even sort of push-ups as well. It's a really common mistake that Bree and I see with clients. They don't really utilize their back muscles when pressing, and that's when we can, if we don't activate our back and bring that in with that stability, that's when we can injure ourselves, whether it's post-op, or even for people that haven't had the surgery. It's just a big mistake that people make, maybe because they're not aware, because when we think we're training one body part, our focus goes there, but our body works all together as one. So that's a common mistake that we see. So it can be a really safe movement. You just use everything to stabilize, use ranges of motion that aren't too big. We don't have to do that. And yeah, it's about the progressions as well. So post-op training, it's not a sprint to get back to where you were, or even more. So we have to listen to our body, and it's even a good excuse maybe to clean up some technique that we didn't really pay attention to. You can only get away with it for so long. So use that time as a sort of nice rebuilding phase, and then start to do it properly and progress at a rate that serves you. And then, that's how we're in it for the long haul as well. So don't feel like it's a sprint to get to, PBs and things again. Enjoy the process. Easier said than done sometimes.
That's what we say. We say trust the process. So new question came in, and this is a very common question, and this is a question that deserves really great information. So I'm glad to share this with both of you. So this member said, I'm scared to take 6 weeks off of training to recover from my breast dog because I don't want to lose muscle mass. What tips do you have for getting through this time? And we see this over and over, and it's different reasons, but it's all the same at the core. I'm scared to lose my progress. I'm scared I'll lose muscle mass. I'm scared that when I start again, I'll hurt myself, or that it's such a staple in my life. I'm scared to not have that for 6 weeks. So I just can't wait to hear what both of you have to say about this. Bree, do you want to start? And then Danny, will pass it to you.
Well, sure. as a a health coach and nutrition coach, I'd say one of my big things is to make sure that your protein is you're getting adequate amount of protein, and even a little extra protein during this time, because your body is going through the healing process. And so when our body is trying to heal from a surgery or an injury, it's we need a little extra protein in our bodies to maintain our muscle mass. So whatever your normal intake is, I suggest bumping it up a little bit just to support your body in that healing process. And then I can let Danny answer on the physical side of it if you'd like.
Thank you.
No,
Sure.
that's a great point, Brie, because a lot of people think, well, I'm not moving as much, I must eat less. But as you
Right.
beautifully highlighted, the body is going through a lot. It's healing. So, yes, awesome. Get that protein in. In terms of the training, this person mentioned, I'm scared to take 6 weeks off. Well, the good news is unless your surgeon has said otherwise for your own reasons. But what we've been saying today is the general guidelines is, at least have the first 2 weeks off, just 2 weeks. And if you notice your body looks different, aside from the implants, that's normal, because we're going to have a little bit of swelling and maybe some water retention, and our muscles might look smaller. And I know this from personal experience, because of course that's the first thing I thought as well. So you're not alone there. So then I sought advice from my mentors at the time. And one of the things was, yes, your muscles might appear smaller, but that's because we haven't been filling those glycogen stores, from training. So what happens is when we do train, the muscles appear fuller because of those glycogen stores, which they haven't been replenished if we're not training. So it doesn't mean you're losing muscle that quickly. It's just, they look a bit different. They're filled with different things. So don't worry about that. But then you don't need to take 6 weeks off in most cases, unless you've been told otherwise by the surgeon. I'm going to always say that. But after that first 2 weeks, that gentle mobility work, going for a walk. And I know it doesn't sound as fun as traditional gym training, but all of those things do add up, and you'll be surprised, just with some banded work or even some body weight movements, it can be still a great workout. But then we also need to have a good chat with ourselves and say, well, what defines a great workout? I don't always have to be sweating. I don't always have to, be hitting PRs or personal bests. Okay, you can just show up and do the movements for that day, and that can still be a really good workout as well. So we need to also challenge our ideas on what we call a good workout. But yeah, so within that 6 weeks, there's still some things you can be doing. Even at that 4-week mark, you can start to bring in, like what Brie explained before, some body weight banded work with your lower body. And then after the 6 weeks, then we can start to sort of play with some dumbbells and resistance bands. But there's lots you can do before the 6-week mark. But it's totally normal how you feel, by the way.
Absolutely.
Thank you.
I felt
So
that way as
encouraging.
well coming back from my surgery. And we have to remember
Yeah.
that muscle has memory, and it will remember and it will come back, and just give it that time and that recovery, because it's so important.
Yeah. And I think you'll both agree 6 weeks is relatively short, to have to take it easy a little bit.
Yes.
Where I had surgery, so I'm an Amelia Aesthetics patient, and they do something called rapid recovery, where they really recognize the value of movement post-operatively. So they have you ranging as soon as you wake up. But I had a really nice experience where I, was basically taking it easy for 2 weeks, and then I was able to begin with lower body and go from there. And when you're resting and recovering, like, those 2 weeks go pretty quick. You're
Yes.
not feeling like high energy. Doing the laundry, it makes you tired. So it goes really quick. And I think it sounds daunting when you think about actually taking that time off. And then you see, like, the body is so brilliant and it heals, and you start to feel better just in time to be ready to move again and start, experiencing some resistance as well. So thank you both for that. This next question, this is also a really good one. This was a topic recently, so I'm really excited to hear what you think of it. But this member asks, and thank you for this question, do I need to stop working out before surgery so that my muscles aren't tight? And this is so common. They're specifically asking about the pecs, and also that if you continue to work out, could the pec be thicker and could that impact your results in some way? So, do we need to stop working out so that the muscle isn't tight?
Um, well, personally, and I'll use anecdotes, but then also professional advice. So, I think ideally you don't want to train right up until the day before, for example, the day of. Maybe we'll give it a little bit of a rest, the day before, but it's important to still train because we want to, when we are training, it pushes the nutrients to those muscles and we create beautiful tissue resilience, and it still helps with our posture. The body is not fragile and it really can go through a lot. So I think it is important to continue training pretty close up until the date. Everyone's going to be a little bit different. However, for postural reasons, for tissue health and resilience and nutrients and blood flow, we do need movement. So even though, in terms of the thicker muscle, I mean, it is quite hard to actually grow muscle, and it's going to take a very, very, very long time. So, again, just like losing muscle, it takes a while to lose muscle, but it also takes a while to build muscle. So if you stop training, a couple of weeks out with your chest, I don't think it's really going to make too much of a difference to how your muscle appears, whether it's bigger or smaller. I think there are definitely a lot more benefits to training, even up till the week before, a few days before, just to keep that tissue integrity and to keep it nice and healthy, nutrient wise as well. That's my personal opinion.
Yeah, I agree. And I think, you wouldn't want to set a barbell chest press PB the day before or the day of, but definitely getting that tissue, like Danny said, getting that blood flow to the tissue, and working on the mobility and just opening it up, because you don't want to, you're going to be sore from surgery, so you don't want to be so sore that you're from working out and pressing so hard, but just enough that you are getting the blood flow and nutrients to the muscle that will help your recovery. A good idea.
Awesome. Thank you. We have a question from the chat. I'm going to pull over. This is a really great question. So, Haley, thank you for asking this question. It says, my surgeon told me to avoid push-ups, so I have, but now she's working with a trainer that says I'm just making an excuse. Can under the muscle implants accomplish push-ups again? Because I'm getting that weird feeling when I try.
I would love to know when Haley's surgery was. That would be helpful. Yeah, but everyone's mentioning that weird feeling because you can't really put a descriptive word. It's just the best way to describe it, the word weird, because it's not really pain. It's just a weird sensation. So I think we can all agree we know what that feeling feels like. As for the trainer saying it's an excuse, I mean, that's a little bit rough, but I'm sure it's out of love. It's always important, to listen to the surgeon, but then it's also important to get advice from the surgeon. Well, for how long? And a lot of people don't really ask enough follow-up questions. They just think, oh, my surgeon told me to stop doing push-ups, and they think it's a full stop and a forever scenario, but maybe they meant for the first 6 weeks. It's really important to have that conversation because no movement should be avoided forever. That's not right. But yes, a surgeon will say avoid it for this time frame. So just get really clear on that. And as for the push-up movement itself, regressions. So yes, we do need a press, but it doesn't mean you have to go straight to, wide grip push up on the ground, which is quite hard for anyone, whether you've had a surgery or not. So find a version that's nice for you, and it might be sort of on a bench or a bar where you're elevated, or a Smith machine where you're on an incline, or a closer grip. So there's definitely many, many, many variations of a push-up that you could do. But then also ask yourself, well, why do I want to do a push-up? Does it have to be that exercise? So yeah, I want everyone to know that there's a lot of flexibility with your training in terms of exercise selection. Ask yourself, well, why do I actually need to do that movement? Can I do a variation instead? People get a little bit married to or tied to certain exercises, and even coaches themselves. You have your repertoire that you sort of get in a habit of giving out to people, but then it's a nice discussion to have with your coach to then help expand their horizon and their toolkit of exercises to think outside the box, because it works both ways. So I think if you do have access, to the surgeon or someone for advice, find out in the future for people, just find out time frames, because it can be a little bit scary if you hear, avoid this, and then they hold that for the rest of their lives, where we know that that's not the case.
Such a good point.
That's brilliant.
Yeah. Bree, do you have thoughts that you'd like to share about, like if you were to have a client come to you and they were asking, do you think that I'll ever be able to do push-ups again with under the muscle implants, how you would counsel them on that? Let's say that their surgeon has said, sure, you can, but they feel that weird feeling. How would you help them?
Well, I would explain to them that that weird feeling is quite normal. And as Danny said, ask me getting a little bit more specific on how long they want them not to perform push-ups. And then we could find other ways, like Danny said, to still work the chest, still have that pressing movement that feels comfortable for her. And then we can progress and find that regression that she feels her best with. And whatever that might be a chest press, that might be, like Danny said, like an elevated push up on a bench or on a Smith machine bar. So we would find her regression that she feels most comfortable with, and then progress from there and see. And again, like Danny made a brilliant point on your why. What is your intention for having a push-up? Do you just love push-ups, or you're like, I want to be able to do a body weight push-up for 20 or 50, or and you make a goal out of that. Then if that client had that goal, then we would work towards that goal over time. But I think it's absolutely a yes to that. We would eventually be able to do it.
I love that. Thank you. Okay, so the next question, and actually I would like to ask something that I think will be helpful. Why, as women, should we train chest? Like, what if it's not for aesthetics, right? And if somebody's watching this and they're like, well, I don't care what my chest looks like. Can you tell us why we should care how our chest functions, what it does for our body, and why we should care about it and not neglect it post-surgery? Danny, if you want to start.
Because she kind of touched on this before. Yeah.
Thank you. Yes, it is very important to train chest, not just for aesthetic reasons. So there's more to life than how we look, even though it's very important, but there are so many benefits outside of aesthetics as well. So posture is really big. And then if we come out of surgery, as I mentioned, we are a little bit guarded and rounded, and then we throw in daily life activities where we're sitting at a desk a lot of the time, we're working, everything is in front of us. And that can actually just keep us in that rounded position for long term. So by training the upper body, it can help with our posture, which will then alleviate dysfunctions in the future, because the body has great ways of compensating. And if we're not using if our shoulder blades aren't moving smooth across our rib cage, or if we're not using our chest and back muscles and shoulders and arms, the whole upper limb, then we can compensate. And we see it time and time again. People get really tight upper traps, neck muscles. It can lead to shoulder pain. It can lead to headaches, which are never fun, but it's more than just, as I said, more than just aesthetics. It's about how we're functioning, the ability to go play with our kids or pick up our kids, work. A lot of us work hands-on. So it's just about recognizing the importance of those movements. It's not just about in the gym. And you might think, oh, those movements are unique to the gym. Well, no, every time you pick something up, every time you reach and grab for something, or Jana, as you said, wiping the counter, all these daily activities that we don't realize we're using our upper limb. We need to restore that for long-term health, because as a population, as society, people are getting more unhealthy in a lot of aspects because they are avoiding movement. So it's really important that we keep that going.
I love that.
Absolutely.
Thank you.
Yeah, and I as a personal story, I was a massage therapist for 15 years, and I didn't before I got into this line of work and knew better. I didn't think I needed to work my upper body at all. I was very focused on my legs and never worked my upper body because I worked in massage, and so I was working my arms, so I felt like I was getting strength from there, and I ended up getting injured. So if I had strengthened those parts to support my work, I might have not gotten injured. So it's all connected
I
in that way.
This is like one of my favorite things to share. I just sent it into our group chat yesterday, but presence of muscle mass is one of the strongest predictors of all-cause mortality, which means dying from anything. And I think as women, that's incredibly important for us to know and to make decisions that are aligned with that. Because if you fall and break your hip as an 80-year-old woman, you are almost twice as likely to die than an 80-year-old man. And it's truly the presence of muscle. So you're really lifting for your life, regardless of how old you are. And we should take advantage of our health when we have it and preserve it. And muscle mass is very important to that, which is why we're here tonight. So, thank you both for that. The next question that I'd like to ask is this member said, can my implants interfere with my posture or my core strength? We talked a little bit about posture. Can we talk about core strength related to implants?
Yeah.
Sure. Yeah.
In terms of interfering with core strength, I think um, I'll go down the avenue of core strength can be improved by performing planks and, for example, front planks, side planks. So yes, you when you are easing back into your training, it is important to remember that whole upper body bracing when we are training our core might bring on that sort of weird feeling again, just because the tensing of the muscles for your core work can carry over into your upper body because that's what you're using to hold your body up. So, yes, core strength is very important because we need to stabilize through the trunk. And the more stable that we are through the trunk, the better strength and output we can have from our limbs. So when it does come to training that, just find some core variations again that aren't too, that don't bring on that weird sort of feeling at the start. So even if you do a plank, maybe try from your knees as well, a little bit less impact. But it is still important to practice that bracing position because we it's not just always about push pull and things like that. It's also about holding yourself up and bracing and allowing beautiful stability through the shoulders. So it can interfere, so to speak, at the start if you yes, avoid planks and things, but then there are so many variations that you can use where you're lying on your back. And Bree mentioned earlier, bird dogs and things like that, or dead bugs. So yeah, there are a lot of variations, but it's just about finding the right ones from your toolkit again. So no movement is really off limit, or no body part to be trained is off limit. It's just about finding the right variations for you for your recovery process.
Absolutely. And I think too, we often think that the posture and the core are two different things, and they're very much linked together. And as Danny was talking about, our rounded shoulders in our posture, and then that will start weakening our core as well. So the more that we strengthen our upper back muscles and our core, our posture will be better. And with these implants, it's a foreign object in our bodies. And usually they are bigger than our natural state. And so our body is getting used to this new normal, in a way. So it's going to take time for the tissues to adapt to this, object in our body. And so to strengthen the core and the upper body, the upper back muscles are really important to do. So it's not necessarily that the implants directly affect your posture and core, but because of that weight, that extra weight in the front, that's what really affects it.
Got it. And then exacerbated by that lack of movement, right? If you don't
Yes.
have the good information. Thank you. So this next section that we're going to move into is sort of like a quick fire where We're going to go through 4 common myths. Just to get your like truth or myth take on it. So this first one, I'll go to you, Danny, and to you, and then to you, Bree. The first one is you can't train chest again after implants.
Definitely a myth, right? You've got 45 minutes of reasons why that's a myth.
This is a
100%
check-in.
myth.
Everyone agrees. Okay, myth. Bree, do you think myth?
Yes, absolutely 100%.
Huge myth. Huge myth. Okay, next one. I'll ruin my results if I lift too heavy. Who wants to go?
Myth if we rush into it, don't rush into it. So with a smart progressive overload plan, you'll be fine. Absolutely fine.
Context is always key, but like Danny said, progression is the key.
Progression is key. I love it. Okay, Bree, I'm gonna throw this one to you. Fitness girls always go over the muscle.
No, myth. As you can see here today, and knowing a lot of fitness friends, especially in the bodybuilding world, who go under the muscle.
Yeah. There's no right answer, right? It's what's best for each person, truly.
Absolutely.
Okay, this last one is, and I'd like both of you to give me your take on this. I should wait a year before doing anything. 12 months.
Absolutely not. That is a very big myth, and we want to get into some sort of gentle movement at least, within straight after your surgery. So, and if you want to wait, just wait 2 weeks, but definitely not a year.
100% agree. Everything that Danny said.
I love it. Perfect.
Be a big of a couch potato then.
Oh, imagine that. No.
Can you imagine? You'd feel really bad if you waited a year. Okay, so I'd like to ask you both, Bree, I'll start with you. Can you, as we're winding down this evening, can you please share just one piece of advice that you wish you knew before having surgery? Like, let's say if you didn't have this background, a piece of advice you knew about, going into breast surgery and recovering from breast surgery that you could share.
I would say choose a surgeon and a team, like a trainer or a knowledgeable in that knowledgeable field. With that, that was I would say choose the right surgeon and team who you feel best aligned with, and who you feel most supported by. So then you can have a better recovery. So if you surround your people and you surround yourself with a team of experts, your recovery will be much greater. So I think that's kind of my 2 cents. And always listen to your body. That's kind of my key takeaway, because your body knows best.
Yes, thank you. It's so true. I love that advice. Danny, how about you?
I think it's best for people to realize that you don't have to stop moving and training. Our body is designed to move. As we said, movement is medicine. So the best way to heal, recover, to prevent, injury and dysfunction in the future, to have a long, strong life, we have to move. By not moving, the only thing that does is help the body get better at not being able to move. So if you are unsure of what to do next, there are people that can help, and you might not find the right trainer or the right person straight away, but keep looking until you do, because it is important to get back into the right kind of training for your body. We don't have to hit a personal best straight away, but we do need to get back into some kind of moving after breast augmentation and any surgery, to be honest. So movement is medicine. Remember that. It doesn't have to be scary.
You got me?
We go.
We're good? Okay, sorry. We're back. We're good. So, Brianne, if if anybody who's watching tonight wants to follow you, we are linking your Instagram. We're also linking Mental Sweat in our chat, so they're able to connect with you there. Same for you, Danny, as well. We're linking your Instagram, and we're also linking your app and your gym. So we hope that if anybody who really is looking for a place to start, or somebody who is already taking part in strength training but considering surgery and wanting to either prehab, rehab, or a combination of the two, that they would reach out to both of you for help. We're identifying you as very valuable and accredited resources to our Bustmob community. So thank you both so much for your time and your expertise tonight, and all of your input. I really can't thank you enough for being here with us and for sharing all of your knowledge and your expertise with our members. It's scary to see all of these things and not know if they're true, and wonder how maybe a surgery that you're pursuing for yourself could have a negative impact long term. And we really want women to know that's not true, that it's a change, but it's a really positive change and one that you grow through. So thank you both so much for being here.
Thanks for having us. We loved it.
Thank you. And thank you to the amazing community. We look forward to being in touch in the future as well. So any follow-up questions, please send them our way.
Absolutely.
Yes, absolutely. To our Bustmob members who joined us tonight, thank you, each of you. It's really hard for me to accurately convey how grateful we are for each of you. Bustmob is for you, and it's because of you. So we're really looking forward to using these events to bring you more expert insight and opinions and empowering you through education. We hope that we see some carryover into the community, and that we continue to get these really great questions so that we can connect you with really high quality answers. And just thank you for spending your evening with us tonight. I know you could be anywhere and you choose to be here, which is really incredible. So thank you all. Thank you to our team of moderators who helped with us tonight. And thank you again, Danny and Bree, for your time. And we will see everyone next time, okay?
Thank you.
All right. Take care.
Bye.
Everyone have a great
Take
night.
care.